Most chiropractors who say they treat scoliosis learned it in a weekend. One seminar, a certificate, back to practice on Monday. That's not a knock on those doctors. It's the structural problem of how scoliosis training actually works in this profession. Scoliosis isn't a diagnosis that you bolt onto another technique. It's a three-dimensional deformity with its own etiology, its own progression, its own bracing research, and its own outcome measures. Most postgraduate chiropractic education treats it as a module in a broader curriculum built for something else, more like pain relief or posture. The Clear Institute built its certificate differently. It's not a weekend. Doctors completed over 30 hours of coursework on scoliosis etiology, x-ray analysis, bracing research, then a hands-on workshop. Then they submit a real case study for submission, and it's independently peer-reviewed before they're actually certified. And certification isn't the finish line. Ongoing case review and continuing education are required to keep it. That's primarily the pathway why I got into the Clear Institute, and that's why I became a Clear Fellowship, and I'm actually on the board of the Clear Institute. It's because it actually has checks and balances, and every year we have to prove exactly what we say we do. If your child or you has scoliosis, ask any provider a direct question. What does a scoliosis-specific certification actually require? A weekend seminar and a structural peer review certification process are not the same credential, even if both doctors call themselves trained. A certification is important. Specifically, when we look at the Clear Institute certification, this is what our entire practice is based on. At Clear Life Scoliosis and Chiropractic Center, this is the standard that we hold ourselves to. If you want to know exactly what that means for your care, book a consultation. The link is below.